Good afternoon. This is Andy Reese with Department on Disability Services. Um, as always, I will start by sharing our data, which I'm happy to report is not that different from last week. So consistent with last week, 446 people. We haven't had any new diagnoses in the past week. We've had 446 people who have been diagnosed with COVID-19, of people supported by DDA. And by placement type, this has been 100 people, I'm sorry, 9 people in host homes, 114 people in intermediate care facilities, 1 person in a mental health facility, 62 people in their natural homes, 2 people in a nursing home, 4 people in out-of-state placements, 41 people in residential placements, and 213 people in supported living. So by placement type, the 114 people in ICFs who have contracted COVID represent about 38% of people in ICFs over the course of this time. And of those 114 people, 28 have died. However, only 13 of those deaths have been confirmed COVID deaths, representing about 11.4% of people in ICFs who contracted COVID and went on to have a confirmed COVID death. In natural homes, the 62 people represent just under 7% of people in natural homes who have contracted COVID. Of those 62 people, we have had 5 deaths, all of those confirmed as COVID deaths, representing about 8% of people in natural homes who got COVID and died from COVID. In residential habilitation, just under the 41 people who have contracted COVID represent just under 38% of people in residential habilitation who've contracted COVID. 3 of those people have died, but only 2 are confirmed COVID deaths, which represents just under 5% of people in residential habilitation who contracted COVID and have had a confirmed COVID death. In supported living, it represents about 22% of the people in supported living who have contracted COVID. Of those, we have had 24 deaths. However, this only 15 of those are confirmed as COVID related. So that represents about 7% of people in supported living who've contracted COVID and have a confirmed COVID death. So overall, in DDA, the 446 people represent about 18% of people supported by DDA who have contracted COVID. We have had 63 people die, but only 37 of these are confirmed COVID deaths, representing just over 8% of people who contracted COVID supported by DDA who have had a confirmed COVID death. And as I reported last month, in the month of October so far, we have had 2 people who've contracted COVID, 1 in a supported living placement, 1 in a natural home. And both of those people were vaccinated. People who've required inpatient treatment, we have not had anyone who's contracted COVID since April of this year who has required inpatient treatment for COVID. Of people who've been diagnosed with COVID who have died, we have had, as I said, 63 deaths. However, 16 of these have been confirmed as not COVID related. And for 10 of them, we are still awaiting confirmation from OCME regarding the cause of death. So that accounts for, there are 37 confirmed COVID deaths And of those, we have not had a confirmed COVID death since March of this year. Among staff, there were 3 additional people who were diagnosed with COVID this past week, bringing the total of staff who have contracted COVID up to 739. 52 of these staff have been reported as having COVID by more than one provider, and we have had 10 staff die from COVID, 10 provider staff. In terms of vaccination, people supported by DDA, we're at 79%. This reflects 88% of people in host homes, 98% of people in intermediate care facilities, 63% of people in natural homes, 96% of people in residential habilitation, and 87% of people in supported living. Amongst provider staff, we've seen significant improvement. Staff fully vaccinated, we're at 88%. And amongst DDS staff fully vaccinated, we are at 91%. So if people have any questions, type them in the chat. Please make sure that you type your question to everyone so that we're able to see it and respond to it. Just as an update before we get this question, transmittal did go out so that providers will have the necessary information to submit claims for retainer payments. That transmittal went out this morning. So that, as we had said before, retroactive to January 1, providers can submit retainer payments. So the transmittal did not address how providers are supposed to coordinate with service coordination and waiver to get the necessary authorizations in place in order to bill against the retainer. What is DDS's guidance for how to proceed? I'm going to stop there and just ask Winslow to respond to that, because we actually, when we reviewed it, there are a lot more authorizations in place than we thought there were, but which have been in place for quite some time, and are still there and available to submit claims against. But Winslow, can you address how service coordination will be coordinating with providers to make sure that authorization, to take the steps necessary to get authorizations put in place in the waiver so that providers can submit claims?
So first of all, this process would be no different from any other authorization between the service coordinator and the provider. Secondly, service coordinators will not automatically be addressing the issue without the provider initiating the discussion and the conversation. Should note that this is, again, no different from any other authorization process. And to your point, Director Reese, we ran a report, and at last check, there were only about 64 people who, as a part of the first round of retainer payments, do not have the same authorization in place or an authorization in place. So 64 is a pretty manageable number. At least at first check, that's what we have. But again, providers should reach out to their respective service coordinators, who will then begin to initiate the process.
And we had received a suggestion that we could assign a couple of people to sort of manage that process for everyone rather than have it be each individual service coordinator. But just as a reminder, to the extent it's necessary, it requires an ISP amendment. And so each individual service coordinator really needs to manage those kinds of things on their own. How many people are currently enrolled in the IFS waiver? 2. Will service coordination be trained on the retainer payments? For example, will they understand that providers will be seeking authorization based on authorizations that were in place prior to the pandemic, do they know that these requests will be coming in? Winslow.
The service coordinators are familiar with the retainer payment. With regard to the question of authorizations that were in place prior to the pandemic, you may recall that we kept authorizations open at the onset of the first round of retainers. So our teams are familiar with the process. And when you say, do they know the requests are coming in? They absolutely are aware of the requests coming in.
So how did you do your analysis of authorizations based on the discussion with other day providers? 64 seems like a low number. There are many folks who don't have authorizations or the same authorization that was in place prior to the pandemic. I think you're raising a really good point. And I don't know if Pam, who did the analysis, is on the phone. We do need to ensure that not just an authorization is in, but that the authorization that existed pre-pandemic is available, because we may have people who have returned to day services part-time who were previously there full-time. And for those folks, we need to make sure that effective January 1, there is an authorization in place January 1 through the middle of May, so that the retainer payment could be paid. And we'll make sure of that. But as Winslow indicated in his first response, each provider would know what authorizations you currently have. And so, I mean, I appreciate there's more it requires a little bit more work in that you have to send something to each service coordinator, but each service coordinator connected to a person whose authorization needs to be expanded to include the pre-pandemic numbers, or who doesn't have one in place, that's how that would need to go. Unfortunately, Pam's out today, so I can't answer the question about how she did the analysis, but there were only 64 folks who didn't have an authorization in place and did have one of those who had one in place pre-pandemic. So it was not requiring as widespread work as we thought it would. However, as I said, for the providers, you would be able to see what authorizations you have. And so from your end, to just sort of immediately review those and get something to the service coordinator saying, in order to submit for a retainer payment for January through, I forget the date in May, but some date in May, I need for there to be an authorization consistent with the authorization that was in place in March 2020. Please let me know what our next steps are and just go from there. And so I see a question. The retainer payment may extend beyond May. No, the length of the retainer payment depends on the number of days per week services were authorized. Absolutely. I was just giving you the example because the fact is we paid 90 days of retainer payment. People might not be clear that that's not just 3 months through March. That's 90 service days of retainer payment. It could take all year to get to that, depending on what the pre-authorization um, days were. Is there any update on how many provider staff requested medical or religious exemptions from vaccinations and how long that review will take? No, there is not. And so when we collect the data from providers, we have not and had not been asking about requests for waiver. We're just getting percentage totally who are fully vaccinated. Um, and so DC Health at some point will have that data for us, perhaps. Donald had a quick announcement to make regarding EVV. I'm not sure if he's a panelist.
Yes, Director Reese, I am now. Thank you. Just wanted to drop in. Good afternoon, everyone, and make a quick announcement. Received a notification from DHCF that they will be starting to deny claims for dates of services beginning December the 1st, 2021. So I just wanted to drop in and notify our DDA providers that are supposed to be in compliance with using electronic visit verification What I'll do also is drop in the chat for the upcoming DHCF EVV stakeholder meeting, which is Monday, October 18th, 11 a.m. to 12 p.m. These have always been recurring meetings that occur every Monday, third Monday at 11 a.m. monthly. So I'll drop that in, as well as if you have any questions for DHCF, their contact information for this project. But again, services claims will start being denied for services beginning December the 1st, 2021. So compliance is very important. And that's it for me. Thank you.
What evidence should we be looking out for provider staff who complete the exemption request? Is there a sample letter? Can you verify what is presented? What Dr. Lewis said last week is that when you submit your documentation, there is some message to you that you can print out that shows what you've submitted. As someone who's not required to submit anything through that system, I haven't seen it myself. But what she was saying is that there is something available to the employee when they submit their confirmation that they're vaccinated, along with whatever documentation, or when they submit their waiver request along with the documentation, that there's something that can be printed out. Perhaps, you could walk through that process with any of your staff or yourself and see, given the possibility, I expect that any of you could be working directly with people we support, certainly legitimate to submit your vaccination information and see exactly what you get from the portal. But as I say, when Dr. Lewis responded to this last week, she did indicate that there is something available that can be printed when you submit. And this is different from the status update completed on the attestation portal, correct? No, that's what I'm referring to. So once they receive something from DC Health, they'll get something from DC Health. And I haven't seen any of those that give them a response to their request for a waiver. And as we said, I believe, I know that the question was asked of Dr. Lewis last week. She's not here this week, but the question about how long you can expect those waiver requests to take, I'm remembering a time frame, but I'm reluctant to say it in case I'm wrong. It'll get quoted back to me. But I know that she responded to it. And at this point, I know that it was a lot longer than a week, or 2 weeks. So at this point, you'll have to rely on employees who have submitted those waiver requests being honest with you and providing whatever they've gotten back. At some point, and I don't know what percentage for your staff, what percentage of employees have sought a waiver. I know at DDS, we've had a very small number of employees request a waiver. And so if, depending on the numbers, you will see what a request that comes back, a favorable request, and that'll begin to give you an idea of how long those take and what they look like. So right now, what staff is bringing back is a confirmation that they completed their status on the portal. It doesn't tell you exactly what they did. Is DDS aware of the number of staff lost to vaccine mandates? Is this being tracked? Just good overall data to have as we're in a real workforce crisis. We do track the total number of staff, the number of staff lost to vaccine mandates. We don't track individually. We have a gross number of staff that is tracked when we do the tracking every 2 weeks that does get updated. And so, as you know, even before the vaccine mandate, there's fluctuations in that number. But we're not tracking specifically and what percentage of those staff left because of the vaccine. In this moment, while there are no questions, I'll also make the announcement that next week, for people that weren't aware, Councilmember Nadeau and the Human Service Committee will be having a hearing on the council members' bill that would expand eligibility for services through DDA to include all people with developmental disabilities. That hearing is at 10 a.m. next Thursday. And if you go to the council website, you could get instructions on testifying. It will be a virtual hearing. Thank you. So Carol has posted a link to her blog. Carol Grigsby has posted a link to her blog, which includes information about the DC Council hearing. For folks who are on the telephone, as opposed to being able to view this on their computer, Carol's blog can be accessed at www.ddinwdc.com. So the one thing I see people are, wanting to make sure that they get confirmation from their staff that they've submitted something on the portal. The other thing to make sure of as we're thinking about the fact that, provider agencies are going through provider certification review, and these mandates begin in October. So folks who have provider certification review, where part of that review is to ensure that staff meet qualifications, will be looking at whether you are, as a provider agency, tracking vaccine status and tracking for people who are not getting a vaccine, whether they have a medical or religious reason for seeking an exemption. What they print out from that portal will tell you that they sought the exemption. As an agency, it seems to me you need to make sure that you have some documentation that there's some basis for them seeking the exemption. The exemptions can only be granted by DC Health, but you should have the documentation yourself so that whatever copy they uploaded there, you should have a copy yourself. So that when PCR does their review, when we do the PCR review, we will be able to, if that record is pulled, we'll be able to see the documentation of compliance there, because that is a requirement for our agencies. So the link for people that wanted the council website link for the hearing next week, who cannot see, it is in the chat, but for folks who cannot see the chat, it is dc council.us/human-services-public-hearing-11. And there's information if you go to that site on, if you are interested in testifying, how to go about submitting testimony. And so for folks who have further questions about the retainer payment, I know the transmittal that went out had contact information at the bottom. If there were different kinds of questions, whom you could contact in the agency, please contact whoever is identified there. I closed my email before these because I don't want to share my screen and accidentally share my email. So I don't have access to those names right at this moment, but anyone who received that transmittal, I just want to direct you to the last paragraph, which does indicate whom you can speak with if you have questions about getting that in place and seeking out that reimbursement as soon as possible. People who do wish to testify at next week's hearing should be aware if you log in to the website we gave you that the deadline for getting your name on the list to testify is Monday, October 18th. That's this coming Monday by the end of the day. But it seems we don't have a lot of questions this morning or this early this afternoon. So perhaps the next 20 minutes, if people are interested in doing it, they could do that now. If we have no further questions, we could certainly end early at this point. I will see folks at the hearing next. Well, we won't, we'll only be there virtually. But for folks testifying, I will see your picture and you'll see mine. And I hope everyone has a great weekend, and we will talk again next week.